So we're going to have a practice demo from one of the students.
Okay, go.
So the first step is to check the area or the scene, make sure the client is lying comfortably. And then first step is to check the client's responsiveness by tapping the shoulders of the client like this. Hey sir, sir, are you okay sir? So the client is unresponsive. The next step is to check the chest movement by placing your palm here, making sure to feel the client's breath and the chest rising for 5 to 10 seconds. So once we notice the client is unresponsive, we should ask or command someone to contact the emergency medical system. So for example, sir, can you contact 117? Then ask someone to bring an AED. Then I need an AED. I need an AED. Then the next step is to check the current pulse of the client here in the neck, 5 to 10 seconds. Then next step is to bear the client's chest and imagine the imaginary nipple line in the middle with your palm, and then give 30 or less compressions, chest compressions.
Your from chest to yeah, that's
Before proceeding to the procedure, make sure that your balance is organized and your knees is bent and supported. Again, put your palm in the middle and then proceed to the 30 chest compressions with the base of neck like this. 1,
keep count out.
30, 40, 50, 60, 70, 80, 90, 1, 2, 3, 4, 5, 6, 7, 8, 9. After that, proceed with the two breaths. Make sure to lift the chin of the client, lift the head, and cover the nose. Open the mouth, then proceed giving the two breaths. Make sure to check the chest rising, and assuming that the AED arrives, make sure to turn it on. Then
Analyzing heart rhythm. Do not
place
touch
the
the patient.
place the padding, the just below.
Shock advised. Charging. Put the pad. Stay clear of patient.
Place the
Do
padding
not
below
shock
the
now.
below
Press the orange
the
button
left
now.
foot. Hear the patient. Here.
Do not shock now. Press the orange button now.
So once the shock is advised, deliver the shock. 3, 2, 1.
Shock delivered.
So the shock is delivered.
Begin CPR.
Once the shock is delivered, the AED will tell you what to do and proceed with the chest compressions again. Then proceed again with the two breaths. Doing the same procedure again, moving the chin, tilting the head, close the nose, and then open the mouth.
Okay. Can we have an evaluation of the performance of our student, Mr. Baliklik? May I be the one to first give my comment or um, evaluation on your performance? Okay, Mr. Baliklik, first, when you check for the consciousness of the patient, it should be a little bit tough. So you have to shake your patient or your client, not just like touching it the way you do it. No. Next, um, when you do compression, it should be a little faster. The one that you did earlier is a little bit slower. It should be in the tune of staying alive. Okay, and then your position of your hand is not at the center. It should be at the center of the sternum for you to be able to really do the compression on top of the heart. And then next, you need to be careful in putting the AED. First, you have to turn it on. What's the next?
Please, sir.
Okay, select pad. When selecting the pad, make sure that the pad should be placed on the right position, no? So you are going to look at the pads prior to attaching because there is a markings on the pads, no? So you don't have to interchange the pads. So make sure before you attach, you already have in mind where to attach so that it will not be interchanged. And then when you do the um, turning on or pushing the shock button, make sure that you have to say clear very loud for you to be able to be be sure that nobody will be touching or near the client or the victim or the patient. So when you say clear, louder, then that will be the time. On the um, third part will be the delivering of shock. Then after delivering of shock, CPR will be advised by the voice prompt. So it will be depending on the AED machine based on the analysis that the machine will do, reading the electrical um, impulses and electrical activity of the heart, then the AED will decide whether to do CPR or not. When instructed to do the CPR, immediately locate the imaginary nipple line and do the compression, at least 100 compression per minute. So when you do that, then next step immediately after, followed by the two breathe or two blows. And after which, what's the next step? So continue when you are asked to continue CPR or when the AED will tell you to stop because the patient is not shockable anymore. That means that you already feel that the client is now having breathing and spontaneous heartbeat. Okay? So can you do it again for the tapping and then the position of the hand and the compression so that we will know if it is already corrected.
So like you said, sir, the tapping should be more tough. So,
It
sir,
should be at the shoulder,
sir, are you against
harder.
Sir, sir. Like that.
Okay. So it is also important for you to make sure that when you tap, it should be, hey sir, are you okay? Hey sir, are you okay? And you are going to shout on the ear of the client, no? It should be directly at the ear. We might probably don't know if the client is deaf or if the client is not hearing properly. So you have to shout, hey sir, are you okay? Hey sir, are you okay? Okay, that's the right procedure. Can you do it now?
Sir, sir, are you okay, sir?
You should lower your mouth,
Sir,
your
sir,
head
are you okay, sir? Sir,
on the other
sir, are you
side.
okay, sir? Sir,
Okay. What about the position of the hand? It should be at the center. I noticed that when you position your palm or your hand, it is here. It should not be here, it should be here. Okay? Because this is the sternum. Can you do it?
so here's the measurement for the single line. Place the palm in the middle, like that, sir.
Okay, that's good.
Then proceed
Now, do the CPR.
like that, sir.
Yes, that should be the beat. Push fast, push firm, and should be hard. Okay? Very good. So, next student.